Good afternoon, everyone. Prananda Paub. Welcome to the National PROMS Annual Research Conference 2022. My name is Sally Lewis. I'm Director of the Welsh Value in Health Centre, and it's our great pleasure to host the conference this year. You'll have noticed that we're not an academic institution, but we're rooted in NHS Wales. Our role is to promote high value care and improve the outcomes of the population of Wales, whilst also promoting sustainability of the healthcare system. In order to understand what matters to patients and how we can meet their needs, we need to understand outcomes, we need to understand quality of life, and we need to understand symptom burden. And this is why we're so interested in PROMS and are on a mission to embed and use PROMS in direct care to support multiple different healthcare improvements, from the consultation to big data research. So what does value look like? Well, we can only understand value and get the best outcomes with the resources we have when we think about it from the patient and population perspective across a whole continuum of care, from prevention through to end of life. And there are many factors that influence those outcomes across the whole pathway. So there are factors on the patient side. We need to really try to think about how we optimise health literacy in the population. So that means how people understand how to look after their own chronic conditions when they're present, or even how to navigate the healthcare system, which can be difficult at times. We need to support healthy behaviours, and that's not just around primary prevention of chronic illness, but also around how we optimise health when people are living with chronic conditions. And we know that there are increasingly large numbers of us who are. And we need to really think about getting the best information, the best data back to patients so that we can understand how to make the best choices in our own context about our healthcare and our health goals. And then on the healthcare side, we need to understand how to finance for value. So what do I mean by that? Well, we need to understand how best to direct resources and where to. And we can only do that really if we're understanding the needs of the population and focusing on meeting true need as well as reducing inequities in health. We of course need to reduce unwarranted variation in care. That means variation that is not supported by evidence or by patient preference. And we need to eliminate low value care that does not improve outcomes. We do need to optimise the positioning of drugs and devices, and I know that Hamish will probably be talking a little bit about that in a moment. And we need to plan for what interventions in health mean for the real population as we extrapolate evidence from ideal populations examined in randomised controlled trials, so that we really make that shift from generalised care to personalised care. So to do all of this, we need a much more data-driven system, and it's also a huge cultural shift. Next slide, please. So because of that, we have learned that the work programme of the Welsh Value in Health Centre needs to focus around 6 pillars of work that facilitate the delivery of that transformational change across the whole pathway of care. We need a strong focus on digital health transformation, which really, from our perspective, homes in on patient-facing technology and how we enhance digital communication with patients, whilst also taking account of digital exclusion, and also all of the issues around how we acquire patient-generated data, such as patient-reported outcomes, and all of the ethical issues around that, about how we might use that information and share that information to support improvements of care across the system. We need constant focus on education, communication and engagement across these professional issues so that we can lead a culture of stewardship. And we're very lucky in Wales that we have the Intensive Learning Academy for Value-Based Health and Care, as well as lots of conferences, webinars and our own website to communicate some of these issues. We know that we need to work in partnership with academia and industry, so we have a growing research programme in that regard, and we know that we need to support healthcare institutions in implementation, not just of implementing PROMS in direct care, but how we harness that data and use it to drive impact and change across the system. So because of that, we also have 2 goals then on person-centred care, where we're focusing in on working with patients and the public around health literacy, shared decision-making and other participatory activities, and working with policy and delivery colleagues around the impact goal, around how we use that information to change the way we deliver healthcare. So you can see that our interest is really about routing data and, in this case, PROMs in direct care for use from the consultation right up to big data. So the content this year is really slanted towards the translation of PROMs in direct care and how we marry up the PROMs research agenda with the translation of that research on the ground for the benefit of patients. And I really hope that you enjoy the excellent programme that the team and the scientific committee have put together. It's my great pleasure today to introduce our first guest, my close colleague, Professor Hamish Lane. Hamish has a clinical background as a reconstructive plastic surgeon. He has vast experience of NHS leadership and has held many roles, including Medical Director and Chief Information Officer of a large integrated health board. And he is now Professor at Swansea University and leads our Value-Based Health and Care Academy, which we're very lucky to have in Wales. Hamish is going to talk to us today about putting research into practice. And Hamish will explore the ways that PROMs are being deployed in episodic and long-term care and across the data collection time course, from their use as a symptom tracking mechanism to support self-management and co-create care decisions, to a research tool to understand the value of new treatments as a population needs assessment for benchmarking and service improvement, or as a component in outcome-based procurement. The use cases for PROMs, as you know, are many, and so are the benefits. However, the routine use of PROMs at scale is still a little out of reach, despite a growing recognition of the challenges and barriers at both a system and individual level. Hamish is going to define some of those barriers and how these challenges are impacting on our ability to unlock the full potential of PROMs. Welcome, Hamish.
Thank